Hi, back again with the second part of this installment of Giving Back. And so now you're about to meet the person who we all kept looking at during the first half. Sunny?
Yes, I'm happy to introduce Roberto Santamaria, the Executive Director of Fairwinds. I would like you to tell everyone a little bit about Fairwinds and sort of your path to getting there, if you would, please.
Oh boy, about Fairwinds or my path?
Start with the path. It was always entertaining because everybody came here. There's a handful of rare birds like Chris Glowacki who just actually.
Oh, well, just get ready. He's a
no,
this is a gem.
Oh boy, so born and raised in Florida. Glimmer of my father's eye. No. So coming from Florida, I did college down there, University of Central Florida. I did my bachelor's in molecular and microbiology. Came up to Boston University for grad school where I met my spouse. Studied public health, epidemiology. I was an epidemiologist and biostatistician. And by a stroke of luck, I ended up working for the city of Everett in their health department, just north of Boston. And at the age of 24, I took over that department and I became the director. So I realized I needed some help there. So I went back to school and I got my MBA at Salve, Regina. And then I took over the health department in Framingham. I was there for about 2 years. And then when Richard Ray retired back in 2015, I applied and found myself on Nantucket, where I realized that we have a very rich and diverse organization, diverse island. So I went back to school again and I got my doctorate at Johns Hopkins in public health and health equity. So from there, I ran the health department here for 9 years. And about 8 months ago, I took over Fairwinds. So for many of you who don't know, if anyone watching, or Sunny, I'm sure you and I have had this discussion many times, Fairwinds is the island's community behavioral health center. So what that is a nonprofit organization that provides mental health treatments, everything from traditional one-on-one therapy to group therapy to dialectical behavioral therapy, DBT, cognitive behavioral therapy, medical management. We have licensed social workers, we have licensed mental health counselors, and we even have psychiatrists and mental health nurse practitioners. We also run what's called the mobile crisis unit, but it's a little bit of a misnomer. We actually call it the behavioral health walk-in clinic. So anyone who's having any sort of an issue, if there's grief in your family, if there is a diagnosis that you want to talk through or anything, and you want to talk to somebody soon and quickly, go ahead and call that crisis line. We're there 24 hours a day, and we will come to you regardless of your ability to pay.
Yeah, it's an amazing service. Amazing.
That's really something.
Yes, it's a game changer. And that last part of we'll come to you with regardless of your ability to pay that's what breaks down barriers. And that's one of the big things, correct me if I'm wrong, that came out of sort of this partnership and you guys, Fairwinds, stepping into this new role.
Absolutely. The partnership with the hospital has been tremendous. So as you heard already through Chris, let me look off camera to make sure to see Chris.
There are actually 20 or 30 people
live.
Right,
the audience.
That's what we're all here.
So what we did notice is that in the state of Massachusetts, a lot of times the first, last, and only line of defense is the emergency department. And a lot of times emergency departments across the country are not equipped to deal with behavioral health crises, especially when they're in the acute stages of crisis. So things like psychosis or breakdowns or things like that. So with that partnership and us taking over the CBHC designation through the state, we were able to create for lack of a better term, an emergency department diversion. So people can come to us so that they're not we're not creating any sort of resource drain at the hospital. We are working in direct partnership there in order to make sure that people get the services they need without having to have that, for lack of a better term, trauma of coming into an emergency room.
That's great, Roberto. And I don't think a lot of people understand how big a change Fairwinds has seen. And I think the two biggest things that I've noticed recently that I'm hoping you can speak a little more to is what used to happen is there was a system that was split based on insurance. And for those of us that need care that's immediate or is in a crisis or is tied to behavioral health in some way, that's the last thing you're often thinking about. So that's one issue that I'm hoping you can speak about. And then the other is the ability to meet people in whatever native language they speak, which on this island is a growing need.
So absolutely, we'll take those one at a time. The split medical care, that's a real thing that you see across the country. What Fairwinds is attempting to do is eliminate that question. When you walk in through those doors, when you call that phone number, when you log in via Zoom or text the number, because we also do, you can even just text the Fairwinds phone number and we can respond that way too. Whenever you contact that, we don't ask about insurance. If insurance is something that you're able to provide and we can do some reimbursements through that, great. But when a person is in a mental health crisis, or if they need to talk to someone, we will not deny services. So we do things like self-pay. You can go ahead and pay, for lack of a term, retail for mental health. You can do your insurance. You can go through Mass Health. But also we have something we call the sliding fee, where if you know you can't pay the retail price, but you can do $20 a session, we'll bring it down to the sliding fee that way too. And that scale slides all the way down to zero. We will not turn people away regardless of wherever socioeconomic standard they're in. And then along the same lines, we are really doing some efforts to meet everyone in their own native language. So we actually have clinicians on island, as well as through telehealth, that speak English, Spanish, and Portuguese natively. So if you can talk to any of them in English, Spanish, or Portuguese as we go along. But also, we have interpreter services that provides interpretation to over 150 languages. So whenever and that's live interpretation. So at any moment, you can call in. You have a meeting with us. We can either bring in an interpreter through Zoom, or we can bring in an interpreter on the phone, and we can always meet anyone wherever they're at in that language.
Absolutely incredible, right? I mean,
what an amazing concept.
All
you
of
can
it.
actually just click them. You can just click them in.
Correct.
As well as having obviously the local folks in the fundamental languages, because all of our communities are driven now in English, Spanish, and Portuguese.
Correct. And the new service that we have actually does video calls as well, so we can also do sign language.
I mean, it's really phenomenal, because you hope people don't ever need crisis services or the hospital. But there's a good chance at some point in your life you might need one or the other or both.
Correct.
And to not have any barriers to accessing that care is massive.
Yeah.
Is massive.
Physical health and mental health are all health. Public health, physical health, mental health.
It's all health.
It's all health. And we on this island are working with all of our other nonprofits, including Community Solutions for Behavioral Health, to treat the whole person.
So, just as the kind of as the person kind of thinking about the numbers in the background, so how do you do that exactly? How do you manage to pay your staff and do all of these things, given these kind of it's called the vagaries of the insurance system and the bifurcated nature of the insurance system? Do you do a lot? You're a 501c3. Do you do a lot of annual solicitations?
So,
do you have an endowment? How do you do that?
Correct. So about 50% of what we do is funded through the insurance carrier reimbursements. We do operate as a private practice as well. Yeah. So you can call us, you can get on a list, you can, our wait list, usually we get people in the office within those 60 to 90 days. It sounds like a lot when you're thinking, but when you look at the national average being 6 months to enter and finding a clinician, we're literally half that. And that's for commercial carriers. So we accept every major carrier like Blue Cross Blue Shield, Optum, Mass General, all of the insurances. But also everything to allow for the sliding fee and to allow for the free services, we do significant amounts of requests. We have our annual appeal, and if it wasn't for our donors, we wouldn't be able to operate the way we operate. That is why it's so important to be able to donate to your 501c3, regardless of whether that's a tax benefit or not to you. It is really important because you're helping your community, whether that is you give to the Nantucket Fund and the Nantucket Fund helps give to us, or you give directly to us, you give to the hospital and the hospital partners. We all need that help. And Nantucket is very fortunate to have a good donor base, but we can always use more.
Yes. So thank you.
Yeah, I would echo that statement loudly. And I think we've talked a little bit about, well, I'm not a rich person, so I can't do that. We can all do something,
We can all
right?
do something.
And whether that's money or whether that's you're the trusted friend that knows your friend is in crisis and you need to reach out, you encourage them to do so, or maybe you don't know who to call, just make sure that you're reaching out to one or all
Yeah.
of us, and we'll kind of help bring those pieces together, because
Yeah.
it takes all of us for a thriving Nantucket.
It takes all of us. That's right. So it just as a curiosity, just having listened to that, it's an incredible story. Where, when you folks are, where are you? Where do you want to go from here? Where do you personally? We don't want you to leave. I guess this is
No,
the main thing. We
not
don't want you to leave Nantucket from here. But as an organization, now that you've seen the place to which you have evolved, but inevitably that therefore introduces you to things you say, oh well, if only we had the. Where is that going?
Absolutely. So there's many services within the mental and behavioral health realms that we're just not able to offer yet. Everything from we do some group services, but we're trying to increase the amount of group therapy that we have, because sometimes a group setting is just as effective, if not more effective, because people want to be a little bit more social. And if you have a homogenized group, so for example, a group therapy for like bipolar disorder, people need to know they're not alone. So we're looking to expand our group therapy sessions. There is something called IOP, which is the intensive outpatient program. That is for people who need a little bit of a step up than individual therapy, but is definitely a step down from showing up to an inpatient facility like the hospital. IOP is that bridge in between that.
And what does that consist of?
So usually what that is it's daily therapy sessions. A lot of times it's in your own home. Sometimes it's also at a general facility location like Fairwinds. We're also redoing the Fairwinds backyard completely so that we can start hosting some sessions in community forums there as well. So little by little, those next steps are coming. The next big step that I'm hoping to do, that I'm putting into our 5-year plan, is to start doing research. If we can start bringing in some of that National Institute of Health money, the NIH, and partnering with the university to be able to bring in PhD level clinicians and start doing some research here so that we can actually do systemic changes on the island.
So really kind of I can never get the word. I can't do it.
Epidemiology.
Epidemiological research.
Correct.
So it's really system-wide as opposed to individual.
Correct.
Which is really kind of consistent with where you in the hospital, where Chris was just talking about where you're all going, to the fact that the question is systemically,
Absolutely.
how are we dealing with this stuff?
Absolutely. And the hospital has an internal review board. It's called the IRB. They actually oversee a lot of research in the United States. MGB is a gold standard. They're considered one of the best hospital systems in the country. And as a result of that, they bring in a lot of researchers. If that partnership is tremendous for the island. And I think groups like Fairwinds, Community Foundation, things like that haven't leveraged that research realm as much as we can.
It's very exciting.
Yeah.
And we're kind of the perfect place for it, right? There is no neighboring community. There
Correct.
is nobody else.
That's right.
It's really us.
And to convince the researcher, well, you have to spend like 6 months in Nantucket.
Oh, shucks.
And it's not January. It's not January.
I don't know if we can promise that.
Maybe we can try to suck a few people into
In the epidemiology realm, we call that a closed cohort. We're a closed cohort.
Yep.
So this was really exciting, right? And it really, I mean, it speaks to kind of the leadership of the hospital, also in terms of seeing how the whole system works, but also in terms of really kind of all of you just thinking about how all of the pieces come together, right? So
Absolutely.
Once again, when you're thinking about where should your dollars be going if you have spare dollars, or especially if we're going to talk some more in some of these shows about legacy giving. When you die, to the extent that you want a piece of what you're leaving to be a legacy that preserves Nantucket. What is Nantucket? Nantucket is this. Nantucket is, people, you come for the beaches, you stay for the community. Nantucket is the community. It's this. So I hope you enjoy these shows. I hope you enjoyed this show. Sonny's got a whole list of new sets of players that we're going to be interviewing over the next several months. And so thank you for watching, and we hope to see you on the next installment of Giving Back. Thank you.